I'm Gabby Logan and welcome to this special production from Oral-B Protect in Pregnancy. Now, most of us understand just how important it is to eat healthily in pregnancy, to avoid certain foods in pregnancy, to avoid certain activities. But what the Childbirth Trust and Oral-B have discovered in a survey they conducted together is that 49% of women don't realise just how important it is to look after your teeth. Well, in this special presentation from Oral-B Protect in Pregnancy, we're going to be hopefully answering some of the questions that you've got on your mind right now. And to help me do that, we have a very esteemed panel indeed. First up, it's Jo Sweeney from the National Childbirth Trust, dental expert Dr. Surinder Hundal, and nutritionist and author of the GI Diet, Fiona Hunter. Nutrition is really important in the early stages, isn't it?
Absolutely. Well, throughout pregnancy, really. I think some of the complications that Jo's spoken about, things like the morning sickness and the constipation, can easily be adjusted by taking some time to look at your diet and make sure that you're eating the right foods.
Sickness doesn't always mean being sick, but for people that are actually physically sick, should you brush your teeth every time you've been sick?
No, I mean definitely not, because when you have that acid reflux, it may be acidic and it attacks the tooth surfaces. It's quite erosive, so the last thing you should do is go right straight into the bathroom.
Because it's the first thing you want to do, of course.
And really, you know what, straight away the acidity in your mouth changes and your teeth actually become more susceptible to actually being attacked. So you should actually wait about 20 minutes before you're going to brush your teeth. If you carry out the normal 6-monthly routine checkups, then you'll avoid gum disease. And I think that even from my own experiences, I see clients of all sorts of ages, and in the UK alone, there's such a high prevalence of gum disease, it's unreal. And amongst pregnant women, it becomes to the point that it's not the most important thing. The gums and teeth aren't the most important thing until it becomes a problem. The first portal of entry is your mouth. You know, look after it, because then everything else will be looked after.
In this survey, it's come out as the thing that women count as the least important thing. When you say it like that, and you think, well, no woman would want any bacteria going anywhere near their baby.
No. Brushing with, you know, the right type of brush, whether it's the cross-action or the pulsar brush, they're very, very important. The pulsar to me is like, you know, the manual brush with the pulse. It's so important because I myself use one, and I'll never get pregnant. Well, not, I don't know, maybe. You never know. You never know. You never know what the future holds. But for me, it's a great brush because it does everything you require it to do. And it's simple and it's effective. And when you're pregnant, you want to keep things simple and effective because there's so much going on in your world. You don't want to complicate things.
Well, throughout this special Oral-B Protect in Pregnancy webcast, we've identified some of the problems women have during pregnancy and how to counter those. But I imagine that my panel have some top tips that they'd like to share with us. So first of all, from the dental care point of view, Surinder, what are your top tips? Bleeding
gums is something that, you know, majority of pregnant ladies are going to get, so don't be alarmed by it. But if you do get it, make sure you do go straight in. Second thing is, make sure you are brushing effectively. You want to be using a toothbrush which not only does effective brushing but is gentle, but also contours to your tooth and gum shape as they should, because you don't want to be wearing your teeth away and being more aggressive on your gums. So using the Oral-B Pulsar is my recommendation as far as that's concerned.
A healthy, balanced diet is important at any stage, but particularly when you're pregnant, obviously, because you're eating to nourish your baby as well. So to remember to eat well. Remember that eating for two doesn't mean eating twice as much. Plenty of fruit and vegetables, 3 servings of dairy products a day. They're important for your bones, but also your baby's bones and teeth as well.
I think early on in pregnancy, investigate your choices, because there are some decisions that you're going to have to make quite early on about where you're going to give birth and the sort of testing that you might have early on. And you may not be prepared to give definitive answers to those. So do some early investigation. And as pregnancy goes on, pamper yourself. Be kind to yourself, be good to yourself. And my advice, read every book you've ever wanted to read, watch every film you've ever wanted to watch, because you'll never have time again. So get your cultural knowledge in before, because your life will be very different afterwards. Thank you all so much. Your advice has been invaluable, and your experience too. Thank you, all of you.